22 minutes past 8 now here on BBC Radio Cornwall with me, James Churchfield. There was a time when there was a real rash of stories all about ME. It's not something you hear as much about these days, but we have got a bit of a story to share with you this morning, a difficult story too. It's about the sister of a woman with severe ME who's calling on the government to adequately fund its plan to overhaul care for patients with the debilitating condition. Rosie Barrett cares for her sister Alice at their home. Alice has been bedbound for 3 years and is tube-fed through her stomach. Our health correspondent Anna Val has been to meet Rosie.
Alice Barrett was fit and well a few years ago. She had just graduated from university with a bright future ahead of her. But then she became unwell. She was diagnosed with ME in 2020 and her condition deteriorated rapidly 3 years ago.
She's completely bedbound, she has a catheter, and she's also tube-fed via a peg tube, which is a tube that goes into the stomach.
Alice has to be in a darkened room and requires 24/7 care by her parents and her sister Rosie.
We need to turn her, reposition her, because she's unable to do that herself. She's also intolerant to stuff like sound, smells, struggles with touch. It's hard for us as a family because we feel useless because we can't get her better.
Rosie Barrett is one of many carers supporting the campaign Therefore ME.
The Delivery Plan is an opportunity to invest in their futures and to stop and reverse the generations of neglect.
She, along with other families and patients, are sharing their stories on social media, urging the government to adequately fund its final delivery plan on ME.
Please fund the plan.
Earlier this year, the Minister for Public Health told Parliament there are currently no plans to allocate additional funding towards the plan.
People with ME and their families and carers are saying, well, how can you deliver a plan with no money assigned to it?
The government says it will publish a final delivery plan for ME by the end of June, focusing on boosting research, improving attitudes and education, and bettering the lives of people with this debilitating disease. It maintains it's committed to funding high-quality research to understand the causes, consequences and treatment of ME, chronic fatigue syndrome and long COVID.
We have around 36 cameras in this room and it will record all of your activities.
At the University of Exeter, innovative research is already underway which could help health professionals diagnose ME patients earlier. Dr. Mansoubi and her team have created a tool which can track and record a patient's movement in real time at home. The software can be used on any device with a camera and means healthcare professionals can analyse a patient remotely.
What we found is that many people are suffering for a long period of time from ME before they being diagnosed. And for about 13% of the cases, we realize people are waiting around 10 years before they being diagnosed with ME.
There is currently no cure for ME, but patients like Alice are desperately hoping this new government plan could help them get back to their lives again.
Anna Val reporting. Well, listening to that, and with me this morning is Dr. Charles Shepherd. He is the Honorary Medical Adviser and a trustee at the ME Association. Dr. Shepherd, morning to you.
Morning, James.
Just listening there to Rosie and Alice's story, I don't think I'd appreciated just how severe somebody's symptoms can be with ME.
No, I think it's often just not appreciated what a debilitating disease this is. And it's not only very debilitating, it's for most people, it's a long-term medical condition. It's something that doesn't go away. The recovery rates for it are really very, very low, apart from in children and adolescents who also get this condition, where their prognosis outlook is considerably better than for adults. But sadly, for most adults who get this illness, it is a long long-term condition. And for around about, we think about 25% of people with this condition, they are either severely or very severely affected, which means they're housebound, and at the very severe end, they're bedbound, and they may require tube feeding, hospitalisation. So it's an illness that is probably lifelong. It has a major effect on quality of life, and sadly this has not been recognised properly by the medical profession or by the NHS, who is supposed to provide care and management for these people.
Yeah, well, we hear now about this delivery plan. I know that you wrote to the minister about this. Did you get a response? And what are you thinking about this whole delivery plan?
Yes. So the delivery plan was actually set up back in May 2022 by Sajid Javid, who was Minister of Health at the time. And he had a relative, a niece, I think it was, who had ME. He appreciated the difficulties that people were getting with diagnosis and management of this condition. So Sajid Javid decided we need a proper delivery plan that was going to look at services, medical education on this illness, getting doctors to know how to diagnose and manage it, and above all, create a much better research environment. I'm part of the working group which is particularly looking at research. The aim of this delivery plan, like a lot of government plans, was to get it all sorted in a year or so, but we're now almost 3 years on from it. We've had a lot of delays. We've had a lot of false promises as to when it's going to be completed. The latest is June. But the patient community and the research community, and I'm part of the research group, as I say, are very disappointed that there's no funding coming with this plan, because you can't improve education, training and management of people with this illness, and equally you can't improve research. We need something really ambitious, considering the number of people who are affected by this, especially we've now got a cohort following COVID. You can't create a research environment that's actually going to create routes into treatment for this illness.
Indeed.
Unless it's much more ambitious.
And bearing that in mind, and bearing the circumstances, the economic circumstances we find ourselves in, according to the Labour government, is there going to be any money? Do you think money can be found to make this plan actually deliverable? Because otherwise it's just a talking shop, isn't it?
Well, it is. It's a lot of platitudes, I'm afraid. And as I say, all the indications that we have had from our meetings with the Department of Health is that it's not coming with any money, which is why I wrote to the new minister, Ashley Dalton, a couple of weeks ago. It's on our MEA Association website. People will read my letter to the minister, expressing deep concern and disappointment that it's not going to have any funding.
Good to talk to you this morning, Charles. Let's hope that there's a change of heart on that to make more of that a reality. Dr. Charles Shepherd there, who is a trustee at the ME Association and also their Honorary Medical Adviser.